Bismillahirrahmanirrahim. So in today's video we will talk about how the Cpap and the Bipap works to improve the oxygen and wash out the CO2. So till now in the previous lecture we talked about how to improve the oxygen by increasing FiO2. So I will go quickly through those things: how to improve oxygenation, how to improve hypoxemia. A patient comes to you and he is not maintaining the sites. So there are two things. If this is the lung of a normal patient, of a normal person, if this is the lung of a normal person, even in a normal person all the alveoli are not working, or we can say some alveoli are working maximum, other are working minimum, depending upon the intensity of VQ mismatch. So these are called hibernated alveoli. So we are having active alveoli and hibernated alveoli. So how can we improve oxygenation? By making them active. Point number one, if we do something to make the inactive alveoli active, we will be able to improve the oxygenation process. Point number one. Point number two, if we do something that increases the concentration of oxygen in the already active alveoli and the conversion of inactive to the active alveoli and the amount of oxygen in them also. So if we recruit more and more alveoli, it will increase oxygenation. Point number one. Point number two, if we increase the amount of oxygen, the concentration of oxygen in the already alveoli and the newly recruited alveoli, it will improve the hypoxemia. So there are two answers. Fill already recruited alveoli with more oxygen, so that was increase FiO2. So if we are increasing the concentration in each and every alveoli, it means we are increasing the FiO2. Recruit more alveoli. The answer to this is increase in PEEP. Now your patient is not maintaining a SAT, we apply the nasal cannula. Not maintaining SAT, we change that with the surgical mask. Even not maintaining SAT with that, what we do next step is non-rebreather mask. Even if with non-rebreather mask, all these three kinds, they are only increasing the FiO2. The amount of oxygen they are increasing in the already working alveoli, and they cannot recruit more alveoli because they have nothing to do with the PEEP. Or we can say if they are increasing the PEEP, that is less than the desired amount. That is less than the desired amount. Or we can say the amount of oxygen that we give with the high flow nasal cannula, we cannot deliver in our ER and in our setup. Now we have high nasal flow cannulas. So what we do after non-rebreather mask, the next step is apply the Bipap and Cpap. How the Bipap and Cpap helps? It improves oxygenation and it washes out the CO2. So it is helpful in two things. Point number one, it improves oxygen. How? I discussed. It increases the PEEP, and if we attach oxygen to it and give full oxygen, it increases the FiO2. So it can works for both. So it can be used in both hypoxemia and CO2. So how does it improve hypoxemia? We already discussed. Coming toward how does it helps in the CO2 retention.